Hey guys, it's Miss Reyes and Miss Ratcliffe, and today we're going to be going over your Reconstitution skill.
All right, so before we start talking about reconstitution, there are a few things I want to talk about. So anytime you're reconstituting, you're going to have a powder vial. Miss Reyes has one right here. So on that powder vial, it's going to have some instructions. Now this one doesn't tell you what type of solution you need to reconstitute this with, but it usually will on the vial, or if it doesn't, you need to look in a drug book. So most of the time you're going to do your reconstitution with your 0.9% normal saline or bacteriostatic water. So it looks like that. Okay, so make sure you're using the correct solution, okay? The second thing is you have to know how much of the solution to put in here. So if you look on here, it's gonna say to yield 300 milligrams per milliliter, you have to add 9.6 milliliters, and the total volume will be 10, okay? So each one of these, if you look, there's a 400 milligram per milliliter and a 500. So you've got to read on here what dose you need and also how much liquid you're going to put in here. So we're going to go ahead and say we're doing the 500. So we're going to add 5.6 milliliters of our bacteriostatic water to yield 6 milliliters. And once you have those 6 milliliters, each milliliter is going to have 500 milligrams of that drug in it, okay? So this is very important for you to understand. You have to do a little bit of calculation here, okay? So I'm going to be reading from your skills sheet so you can follow along with me. So first we're going to review our healthcare provider's order and the medication administration record for the correct patient, medication dose, route, indication, time. We're going to review our drug book for actions, required assessment, correct dosage, route, side effects, and expected results. We're also going to maybe look up what we would reconstitute this with, okay? State our 7 rights of medication administration. We're going to assess our allergies. We're going to select the correct medication, checking for the medication name, dose strength, dose volume, dose route, its appropriateness, expiration date. We're going to look at it, make sure it's not cloudy or discolored or anything like that. Now Miss Reyes is going to wash her hands. We're also going to perform our 3 medication checks that y'all learned during our med administration. All right, so now we're going to remove the cap from the medication vial and the diluent vial for access to the content, and we're going to clean both of those stoppers with separate alcohol swabs. So remember, we already looked and we know that we need 5.6 milliliters of our saline to inject into our powder. So Miss Ray is going to draw up the amount of air equal to the amount of diluent you plan to withdraw from our vial. But before we do that, she's going to go ahead and connect a blunt needle. And we wanted to show you, because I have a lot of students ask, we have 2 different kinds of blunt needles here. This is a red blunt needle. You'll see this a lot in facilities. And then we also have a plastic blunt needle, okay? This may be the one that you see in your skills kit. Either are fine. Both of them work well.
I'm just going to pull it out. I'm not going to use aseptic technique right now because I want you to actually see it. So I'm going to pull it out so you can see it. So you have the cap, and then when you take it out, you see that it's a plastic cannula.
Okay. All right, so Miss Reyes is going to use the red blunt needle, so she's going to connect that to her syringe. Okay, so she's going to draw up her 5.6 milliliters. Now she's going to inject that air through the rubber stopper into the vial, keeping the tip of the needle above the fluid line, and inject it. And then we're going to draw up that 5.6 into the vial. And we're going to maintain our sterility here. Move it just a little bit. Okay, so she has her 5.6.
I'll go a little lower because there's a bubble up here at the top.
All right, so now that she has that done, you're going to inject the correct amount of diluent into the vial of powder medication. Now, these powders have been sitting in a warehouse somewhere. A lot of times they're really hard to reconstitute, so just be aware of that. Okay, so we no longer need that for the moment, so she's going to recap it. So now we're going to mix the medication thoroughly by rolling it in our palm. Do not shake it. Again, this sometimes takes a long time, especially with these demi-dose vials, but on real medication, you want to see that there's no more powder and it's all reconstituted into a liquid.
I see some students that want to do it like this, and that doesn't really reconstitute it well. So if you turn it on its side, it'll reconstitute most of that medication. You're going to see in this video that there's still some up here that's not reconstituted. Again, it's just because it's been sitting up for a while, so we're going to say that it's all reconstituted.
Okay, so for a real patient, you would want to make sure it was reconstituted. Now we have to know what dose we're going to be giving to our patient, okay? So the first part was that we reconstituted it correctly. Now we put 5.6 milliliters in here, yielding a total of 6 milliliters of medication, each milliliter containing 500 milligrams, okay? So we're only gonna draw up 1 milligram, or 1 milliliter, which is 500 milligrams to be given. All right, so Ms. Reyes is gonna pull back the syringe plunger to draw up the amount of air needed equivalent to the medication, so that would be 1 milligram, and then she is going to place it into our reconstituted vial, and she's going to drop 1 milligram. So now that she's inverting the vial, she's going to pull her 1 milligram out. It's really important here that you get your bubble out, okay, because we don't want to have too much medication or not enough. I always like to pull more up and get my bubble out and then push out the extra.
You can see that this one has a small bubble in it.
All right, so now that she has her medication, she would have to check and make sure she was administering that by the correct route. She is given 1 milliliter, which is 500 milligrams. All right, so at this point, you're not going to be giving an injection or anything for this skill. This was just reconstitution. I want you to be aware that you will be given a drug. You will have to look and reconstitute that drug and then prepare it appropriately to give to your patient. So please prepare yourself for that. You can bring your drug book and utilize it, but make sure you're able to find that information. All right, guys, let us know if you have any questions.